Well, hey guys, happy Vlogmas Day 7. For today's Q&A, as you can tell from the thumbnail and the title of this video, I'm going to be talking about all of your questions with regards to Retin-A or tretinoin. Now, I envision this being a multi-part Q&A, so today I'm just going to give some general overview addressing your questions about tretinoin and Retin-A. But in next week's Q&A and potentially a third Q&A, I'll get into some of the more specific questions about Retin-A for anti-wrinkles, Retin-A for anti-aging, Retin-A for acne, and Retin-A for dark spots and melasma. So yeah, I'm excited. You guys have been asking for this, so hopefully it can go through the Q&As throughout Vlogmas as a little Vlogmas treat for you guys. And if you're new here, welcome. My name is Andrea. I'm a dermatologist. I post day in the life of a dermatologist vlogs. I'm participating in Vlogmas, where I upload a video every day in December. Some of which are vlogs, some of which are focused skincare content, like skincare product reviews, and reviews in which I go over salient skincare ingredients. So if this type of content is of interest to you, then stick around for more. So topical retinoids are creams, gels, lotions that contain vitamin A derivatives which function to affect the skin cells' rate of proliferation and degree of keratinization, meaning kind of the degree of how hard and scaly the top layer of the skin becomes. The hard and scaly stuff on the very, very top layer of our skin, it can give the skin a dull kind of appearance, and it also can fill the pores and contribute to closed comedones or whiteheads, blackheads, and is problematic in people suffering from acne. And in the drugstore, there are many brand names of what are called cosmeceutical retinols that contain a variety of retinols or retinaldehydes. Retinols and retinaldehydes in cosmeceutical formulations have the potential to be effective, okay? But they're not the retinoid in its active state, and so are less likely to be efficacious. They require an enzyme in the skin to perform an additional step on them to get them to their active state. So it's kind of a mixed bag as far as if they're even going to work or not. They're non-drugs, so they're not regulated, and therefore it's difficult to say for sure which brand or which formulation is efficacious. But they differ from the stronger prescription retinoids for sure. And by stronger prescription retinoids, I mean those that are retinoids in their active state, which when applied to the skin are efficacious and undergo far more scrutiny as far as having to demonstrate efficacy. These include tretinoin, which is the generic name, and the brand name is Retin-A or Renova or Retrieve. There's also another prescription retinoid called tazarotene or Tazorac. And while I said that retinols and retinaldehydes sold in over-the-counter formulations are not reliable, here in the United States we now have a over-the-counter retinoid cream, meaning a retinoid in its active state, which is FDA approved for acne only, that is sold as the brand name Differin, generic name adapalene. So that is another retinoid which is in its active state that you can actually here in the US pick up over the counter without a prescription. Differin's name is adapalene, and it's also part of a prescription medication that is in combination with benzoyl peroxide for acne. This is called Epiduo. So Epiduo and Differin both contain adapalene, which is a retinoid that is FDA approved for acne. I get many questions on what these different retinoids are used for. I alluded to this a little bit in the intro as far as subsequent Q&As that I plan to do, but retinoids are utilized in dermatology for many, many, many things. But the most common things that retinoids are used for and have a long-standing track record for being efficacious for are acne, first and foremost, tretinoin or Retin-A cream, as well as adapalene, Differin, are very, very effective tools in most acne treatment armamentariums. They help to peel the skin a little bit, they help to break up clogged pores, and they help to retrain the biology of the skin cells to behave properly in acne, okay? So they're very efficacious. Tretinoin, or brand name RETIN-A, is also FDA approved for some of your anti-aging concerns, namely wrinkles and fine lines. Tretinoin has also been shown and is well known to reverse some of the visible signs of photoaging. And by photoaging, I mean the consequences on our skin of cumulative lifelong exposure to ultraviolet light from the sun, namely things like discoloration, saggy skin, dry skin, and wrinkles. More importantly, at least in my mind, is that tretinoin can be also efficacious for reducing the number of pre-skin cancers or actinic keratoses that people form. So it's got a little bit of a chemopreventative nature to it, in that it can potentially protect you from forming skin cancers, certain types of skin cancers down the road, okay? And then I mentioned that retinoids are also part of dark spot and melasma treatment. We know that tretinoin, when applied to the skin, can inhibit some of the enzymes that make pigment and drive discoloration in the skin. So tretinoin has been demonstrated to be efficacious in improving the appearance of melasma, as well as something called post-inflammatory hyperpigmentation, or those sort of dark spots that people with darker skin types particularly are plagued by, dark spots that tend to occur after acne has gone away and has healed. Those can really stick around for a long time, and tretinoin has been shown and is well known to be efficacious in helping expedite the improvement of the appearance of those dark spots. And in subsequent Q&As, I'll talk a little bit more about how that works and the specifics of tretinoin and triluma and melasma. For the most part, it is indicated for the face and the backs of the hands for, photo rejuvenation. But it also can be applied to the back for people plagued by acne on the back, as well as other areas of the body. People ask me a fair amount about putting it under the eyes, and I caution you to not do that without first discussing with your treating healthcare provider. So I'm not saying that it is out of the realm of possibility of what may have been recommended to you by them. But for a general audience, I always caution you guys against putting retinoids around the eyes, because they are very irritating, and the skin around the eyes is very, very thin, and this can cause problems. Furthermore, if the retinoid gets in your eyes, it will cause something called a keratitis, and you will be very unhappy. Likewise, people ask me about putting it on the neck, and I caution you against putting it on the neck without first discussing with your treating physician. The reason being, the skin of our neck has fewer sebaceous glands than the skin, say, on our nose, on our forehead, on our upper back, those areas. It's more prone to irritation from tretinoin or retin-A or any retinoid, and as a result, it's more prone to some of the side effects. So best to not put it on the neck unless you have been specifically advised to by the treating or prescribing physician. Probably one of the things people hate the most about topical retinoids like retin-A or tretinoin are the side effects, namely the irritation, okay? Tretinoin, retin-A, is a retinoid that functions by thinning the top layer of the skin. And particularly in people who are naive to retinoids, it does this pretty robustly, depending on the concentration, in the first few weeks, okay? And so people experience quite a bit of dryness, quite a bit of peeling, redness, irritation. So as far as how to kind of cut down on that, it's frequently recommended that you start the retinoid, kind of on an every other day basis, very small amounts. Just a pea-size amount to your face is really all that you need. Usually people think they need to keep putting more on, and that can be problematic. Just a tiny pea-sized amount, as I show in my different tips video. You really don't need very much. Just a thin film on the area. It's been shown that using a retinoid on the face a few nights a week alone can be efficacious, just takes a little bit longer. So it's generally advised that you start out, at least in the beginning, doing it just a few nights a week until some of that peeling and irritation starts to subside, and you can get to a point where you're able to put it on a more consistent basis, like a daily basis, for example. The other thing that's very, very important to know about retinoids is that as they are thinning the top layer of the skin, they increase the chances of sun coming into the skin throughout the day, okay? You have less of a crust built up to block sun coming in. So sun protection is really, really paramount when using a topical retinoid. There's also quite a bit of peeling in the beginning as well, and people always ask me if they should be scrubbing that or using one of those sonic cleansing brushes to remove the peely stuff. And I would caution you against doing that, because the more that you scrub the face and try and aggressively remove that, the more irritated your face is going to become. So that doesn't really have much of a calming effect. It can transiently kind of improve the appearance by removing some of that dead scaly stuff that's built up on your face, but it really just lends itself to more irritation and more problems. So I usually, just encourage people to back off on all of those medieval torture devices that I see all over YouTube. But in addition to increasing your susceptibility to sun damage and sun coming into the skin while you're on a retinoid as it's thinning the top layer of the skin, it also increases your likelihood of getting a windburn. So be careful if you're going skiing and you're on a retinoid. Make sure to put a thick barrier on the face if you're using it there, and lots of sunscreen. The other side effect that everybody is very, very fearful of is the what they call the purge with acne. So it has been observed that in people with acne using retinoids, they can get a slight flaring of their acne within the first 2 to 3 weeks, sometimes out to a month of using the retinoid. This is really just because there's acne under the skin already, and as you're thinning the skin, some of that surfaces. Likewise, it's irritating. With irritation comes a little bit more inflammation in the skin, and as a result, acne can get a little bit worse in the beginning. But it generally, like I said, subsides, at least by a month. So I get many questions like, I'm still purging 6 months in. To me, that does not really sound like the retinoid. That sounds more like poorly controlled acne. So best to see your dermatologist for evaluation and management for all of these things, and follow up with them consistently if you've been prescribed this, so that they can advise you on side effects and modify treatment regimens appropriately based on your particular skin concern and skin type. The other thing that is not known and generally discouraged is the safety of retinoids in pregnancy. These are not considered to be safe for pregnant women. Sorry. There's not a whole lot, unfortunately, for acne in pregnancy. So some general tips for starting a retinoid that I can give you all. Since it is prescribed and utilized for many indications, it's hard to give really specific kind of pointers, but some general things that will help. First and foremost, make sure you tell your treating healthcare provider of any other topical acne medications that you may be using, or topical anti-aging things that you may be using, as some ingredients can interfere with the retinoid and potentially compromise its efficacy. Specifically, salicylic acid, benzoyl peroxide, lactic acid, mandelic acid, some of the acids in your kind of cosmeceuticals and that sort of thing can potentially degrade the retinoid a little bit. make sure you talk with them first, because depending on how you have been advised to use the retinoid, say for example, you've been advised to use it in the evening and another acne control such as benzoyl peroxide in the morning, that may be fine. So it's kind of difficult to just make a blanket statement that you should stop those things. Really what you should do is talk to them, because depending on how you may be best served by this, it may be okay to continue it in a certain way of doing it. So talk to them, but make sure you tell them. In general, retinoids in a cream vehicle are less irritating than retinoids in a gel vehicle, which is interesting because many people in my different tips videos comment that the different gel makes them a little bit oily and shiny, which is kind of strange because the gels are usually a little bit more drying. So I don't know if that's more compensatory oil as a result of the drying component. Personally, I find the different gel to be pretty moisturizing, so that could be individual dependent. So talk with the prescribing healthcare provider. Sometimes switching the vehicle can help quite a bit. So you may be on a cream and find that you prefer the gel better. As I said, retinoids can be used on an every other night basis in the beginning, and that will reduce the degree of irritation that you kind of suffer along with and make things go a little bit better for you while it is still efficacious at that low of a frequency. And then eventually, as your skin gets used to it, you could potentially build up to daily use. And to further decrease irritation, what I think works best is to apply retinoids to a dry face for sure, as water on the skin increases the irritation that you will experience with the retinoid. So definitely always apply it to dry skin. But the way I apply my retinoids and think they are best tolerated with lowest resulting irritation is to cleanse the skin, and in the evening take off your sunscreen and makeup, and then apply moisturizer to a wet face. Allow the moisturizer to dry, and then apply a pea-sized amount of the retinoid. You don't need very much, again, to the entire face or the entire area. You really only need that pea-sized amount to make a thin film. By putting it on a moisturized yet dry face, you decrease irritation from water, and you decrease irritation from putting it onto a skin barrier that is freshly cleansed and dry and not moisturized. Okay, that is a impaired skin barrier. You always want to moisturize your skin after you cleanse it, because you just disrupt the skin barrier. So by moisturizing the skin after disrupting the skin barrier, allowing it to dry, you really cut down on the amount of irritation that you'll experience when you put an irritating retinoid on it. So that's the logic there. The package insert, I think, tells you to put your moisturizer on last, but dermatologists recommend kind of both ways. There's really no consensus, and both seem to be efficacious. Definitely make sure to avoid getting it around your eyes, around your nose, or around your mouth. Those areas are most sensitive to irritation by retinoids. And a tip for doing that is after you've moisturized your face while you're waiting for it to dry, put a little Vaseline around the corners of your mouth, around the corners of your nose, and in the crevices of your eyes, kind of around your eyes to protect them. Kind of seals off those areas from the retinoid getting in. But as I said, probably what is most paramount is that you use a sunscreen throughout the day, and you use it pretty diligently. By diligently, I mean it should be applied, you should apply several layers each time, so as to avoid skip areas. This is common. People just put one layer on of sunscreen, and it's like painting a house. So they've skipped many areas and they're not protected. So make sure you put several layers of a broad spectrum sunscreen on the face, as well as neck, any exposed areas. You reapply it periodically throughout the day, and every 2 hours while you're outdoors, okay? I have some sunscreen tips videos and Q&As on sunscreens that go into this in more depth, so make sure you check those out. I will list them in the description box below. I get questions, is it okay to still wear makeup? Yeah, you can wear your usual makeup while you're on a retinoid. That's generally fine, but definitely avoid harsh scrubs, harsh soaps, anything that's going to be drying, any alcohol-based toners on the face for sure. That will just exacerbate irritancy on the face and kind of worsen your plight and not give you any enhanced control of your skin disease. In last week's Q&A, I discussed how to moisturize the face. That seemed to be very popular. And then I posted a subsequent video on some of my favorite facial moisturizers. Make sure you check out that video on how to moisturize the face. Moisturizing the face before applying your retinoid is really, really important, and selecting a moisturizer that is fragrance-free and free of common allergens is really, really a prudent thing to do, as it will decrease the chances of you developing a skin allergy to something in the product while on a retinoid and your skin is kind of irritated and trying to heal your skin disease. Some people with very, very sensitive skin, namely those with rosacea, may not tolerate retinoids very well, so definitely make sure you follow up with your treating physician very, very carefully to make sure this is right for you. Sometimes retinoids can be very, very problematic for people with rosacea. Rosacea can oftentimes look like acne, so I caution you against self-treating what you think may be acne when in reality it could be rosacea, and a retinoid might worsen that for you. So definitely see a dermatologist for evaluation and management would be a number one tip, and follow along with them consistently. So in the description box of this video, I will list some gentle cleansers that are great for taking off your makeup and will not be irritating or drying to the face, that are fantastic for people using a retinoid, as well as really just anybody. So I will list those down below in the description box, as well as some sunscreens that won't, quote, clog pores or shouldn't, that are moisturizing for you to use throughout the day, easy to apply. I will include some that are available both in the US and the UK, as well as some good facial moisturizers like we talked about in last week's Q&A. So I hope you enjoyed this first RETIN-A Q&A. Stay tuned for next week. I'll probably be talking about RETIN-A for anti-aging and wrinkles and other retinoids and retinols for that, and if they're worth it, so stick around for that. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys